SpheraPro is a programmable shunt system that controls the intraventricular pressure in patients with hydrocephalus. A catheter inserted into the cerebral ventricle and connected to a pressure-controlling valve redirects the flow of CSF to another part of the body, such as the peritoneal cavity, where it is absorbed. The complete system consists of a puncture reservoir, a programmable valve SpheraPro, and an anti-gravity device SpheraGrav. The perfect fit between the ruby ball and the titanium seat of the SpheraPro mechanism provides precision in the control of intracranial pressure. The SpheraPro features an innovative magnetic adjustment mechanism with neodymium magnets and a dual coil spring locking system. Composed of tungsten and ruby balls, the SpheraGrav anti-gravity device provides control of overdrainage during a patient's postural change. The three components of the system are made of polysulfone and titanium connectors that won't fracture during or after surgery. The system has a low implant profile and is entirely silicone covered to provide comfort to the patient's subcutaneous tissue, whether adult or pediatric. Let's understand in details how SpheraPro works. When accessing the valve, the drained CSF presses the first ruby ball, opening the mechanism. The coil spring, pressed by the rotor, applies a CSF pressure resistance, keeping the drainage within the programmed pressure range. CSF flows around the rotor through wide flow channels. During pressure adjustment, the two locks are magnetically released by the programming device, allowing the variable radius rotor to move. When the rotor rotates counterclockwise, the valve pressure increases. When rotor rotates clockwise, the valve pressure decreases. The rotor has two magnets with locking pins pressured to the center by coil springs. The action of external magnetic fields from any direction cannot release both locks at the same time. By moving in opposite directions, even when one pin is released, the other is forced to remain in the locked position. This innovative mechanism prevents involuntary deprogramming, even when the patient undergoes MRI examinations of up to 3 Teslas. Now let's understand how the SpheraGrav anti-gravity device works in preventing overdrainage. The cerebrospinal fluid column present in the peritoneal catheter generates negative hydrostatic pressure when the patient rises and may cause ventricular overdrainage due to the siphon effect. The SpheraGrav does not work when the patient is lying down, as the metal spheres do not apply weight on the ruby ball, and the intracranial pressure is controlled only by SpheraPro. However, with the postural change, the anti-gravity device begins to act, neutralizing the negative pressure in the siphon effect, thus preventing overdrainage. The weight of the tungsten balls on the ruby ball increases the system resistance, but the drainage flow is not interrupted. The SpheraGrav device pressure should be selected prior to implantation according to the patient's weight and height. The combination of the SpheraPro programmable valve, with 8 settings of pressures, and the SpheraGrav anti-gravity device, with 6 available pressures, provide a genuine intracranial pressure control. SpheraPro valve programming procedure with the RegPro digital device. Position the patient in a lateral decubitus position with a pillow under the head, aiming to keep the implant site as horizontal as possible. Prepare the device for the procedure. To increase the pressure, hold the top part of the programmer with one hand, and with the other, turn the base counterclockwise until the indicator pin, located in the center of the programmer, is in the plus position. Ensure that the programmer and other devices with magnetic fields are at least 80 centimeters away from the reader. Take the digital reader and press the side button for 3 seconds to turn it on. Press the button again to calibrate the reader. Using your fingers, identify the position of the valve on the patient's head, and place the positioner at the correct angle, with the flow direction arrow aligned with the path of the distal catheter. Insert the digital reader and aim for precise alignment with the circle mark until the check symbol appears, taking the pressure reading. Carefully remove the reader, ensuring not to move the positioner. Insert the programmer so that the marker points to a lower pressure than the indicated reading. Slowly rotate the device counterclockwise, passing through the current pressure until the desired pressure is reached. Carefully remove the programmer, ensuring not to move the positioner. Place the reader again to confirm the new adjusted pressure. To decrease the pressure, hold the top part of the programmer with one hand, and with the other, turn the base clockwise until the indicator pin located in the center of the programmer is in the minus position. Insert the programmer so that the marker points to a higher pressure than the indicated reading. Slowly rotate the device clockwise, passing through the current pressure until the desired pressure is reached. Carefully remove the programmer, ensuring not to move the positioner. Place the reader again to confirm the new adjusted pressure.